We all know that human behavior is not always logical. Sometimes one of the strangest things our mind can do is to get afraid of certain things that are not actually dangerous. Many of us, even now, we have strong and even uncontrollable fear towards certain situations, things, or towards some creatures. These reactions are uncomfortable and even disrupt our lives, and these reactions are called phobias. Whereas coming to the history of phobias, the first written reference to all the phobic problems we all have is stated in the written records of ancient Greek physician Hippocrates. However, the word phobia is not used till 500 years from then, and later it was first used by the doctor Celsus while studying the word hydrophobia. Let me state you the difference between fear and phobia. Generally, we all know that fear is a normal response to a genuine problem, whereas phobia, it is an unrelenting fear towards certain situations or towards certain creatures or things. Let me state you the causes and its classification of phobias. Coming to causes, generally a phobia can be developed during a childhood or also during an adolescence age. But all the causes for developing a phobia are not known till now. Coming to the classification, phobias are of two types. First one is specific and the next one is complex. Specific phobias. Phobias such as acrophobia, which means fear of heights, come under this type. Specific or social. Sorry, specific means specific or simple, social means complex. Specific phobias are often linked to early childhood negative experiences. Whereas coming to complex phobias, the perfect cause for these type of phobias are not known till now. However, it was thought that these occur through brain chemistry, genetic disorder, and through some life experiences. And there are hundreds of types of phobias, and here are some of them. First one is acrophobia. In my previous slide, I have already stated that it means a fear of heights. And the next one is glassophobia, which means fear towards glass. And the next one is monophobia, fear for loneliness. Next one is aquaphobia. The name itself reveals that it's a fear towards water. Next one is nyctophobia. It's a main commonly seen phobia among people, which is fear towards darkness. Next one is achievophobia. Friends, it is strange that even some people have fear to achieve something, and this is known as achievophobia. Next one is ictoromonstrous squid jellyphobia. Can anyone guess what type of fear it is? Say fear towards longwords. Yes, absolutely correct. It's fear towards longwords. Next one, coming to the effects, all phobias can limit our daily activities by increasing our anxiety and depression levels. Next one, the main criteria for diagnosing a phobia is that it is life-limiting. And the next one is isolation. The limitations which are associated with phobia makes us to feel isolated among people. And she is the girl Sophie, who was targeted due to dentist phobia. She has developed fear in such a way that she even stopped eating, drinking, or speaking to anyone else, and she weighed less than 4 stone when she before death. Sure. Coming to the diagnosis, this involves 3 types. First one is therapeutic techniques, next one is medication, and the next one is combination of both. This combination is only used in special cases. First one is therapeutic techniques. Cognitive behavioral therapy. This is the most commonly used therapy in order to diagnose a phobia. This CBT involves exposure to fear but in a controlled setting. Next one is medication. Antidepressants and anti-anxiety medications help us to control both physical and mental reactions towards fear. And this is a statement which is stated by a girl who is suffering from nyctophobia. I remember being accidentally locked in a dark room by my grandmother when I was a child. She thought I was out playing with my friends and she was near death. So my students did not help at all. And since then I developed a severe fear towards darkness. What's unusual is that this kind of phobia rarely continues into adulthood, and apparently I'm one of those unusual cases. By seeing all these, we may conclude that overcoming phobias and these type of fears is a bit difficult. Yes, I do agree. Overcoming these phobias is difficult, but there's a hope. Let us come to the reality of fear. As she stated that she is afraid of darkness, actually she is not afraid of darkness. She is afraid of what's in it. Many of us are afraid of heights. Even me. But actually we are not afraid of heights. We are afraid that we may fall from there. Many people are afraid of trying. Actually they are afraid that in order to fail for the same reason for the next time. But there is a key which helps us to overcome these phobias and fears is to have courage and believe in ourselves. Friends, courage is not the absence of fear. It's an acquired ability. We should develop that in order to overcome the fear and move beyond that fear. Not only which we may face in our future. So friends, be courageous and believe in yourselves. Thank you.